Hey, it's Mark again with Blue Water. I'm going to talk to you real briefly about, as a consultant, what I feel is the major thing to be keeping your eye out as far as a goal for your disease management programs. Now, what is disease management? Disease management is really the overall arching effort for group-based insurance medical plans, the employers of such, and the insurance carriers to create a healthier population by helping to manage the care within the population. It also falls up underneath a brand topic of population health management, which includes both disease management as well as wellness. Now, why do we talk about that? There's a previous section and a different blog that you could probably take a look at that refers to where the money goes when you pay an insurance carrier some money. But the Cliff Note version of it is that for majority of employers, somewhere between 70 and 80% of the dollars that you pay are going to unpooled claims, recurring expected claims from year to year. And disease management helps to control those claims. Now, basically what you've got is you have a healthy, smiling employee, and we go along in life that we all experience this, that we come along and then over time we get sicker as an overall population. Now, what disease management does is at some point in this continuum, as this person walks from being a healthy employee to being an unhealthy employee, something happens. They either have an episode, they end up going to the hospital, they have a physical and learn that they have high blood pressure, something happens. And it causes something to happen in the claim system at the insurance carrier. Red flags go off that then sends that person off to a disease management unit. Then there are a lot of different efforts and a lot of different programs that engage the employee to try to give them the tools that they need to be able to become healthier, to coordinate their care, to make sure they're not having drug interactions and things of that sort. The whole concept and area of disease management is an enormous area, and there are a lot of different vendors that really can do a good job at controlling healthcare costs, because this is an enormous part of your overall cost, because you know, it's the 80-20 rule. Actually, in healthcare, it's more closer to actually 90-10, or at least 85-15, in that 15% of your population, the sick minority, are really driving your claims, which drives your overall cost. So the goal of disease management is to get these people into this program. So the question becomes, as an employer, what can you do to help this process along? Two things that I recommend to my clients that makes a whole lot of difference. The overall goal is to push this continuum back so that this process happens sooner rather than later. And there are two easy ways that you do it. Number one, you do it by requiring or incentivizing employees to get a physical. If I go get a physical once a year, and whether I pay more for employee contributions as part of an overall bona fide wellness program as defined by the Department of Labor, you can certainly do it that way to give me an incentive to go get my physical. That's a good way to do it. Or some people even go to more drastic situations about what plans they're eligible for, and those plans of course continually change based upon the DOL rules and the GINA rules, which were released in 2009. So that's something you want to talk to your consultant about. But overall arching, the goal of it is to use a physical to catch this person before they have the episode. The second way that you can do that is through a personal health assessment or a health risk assessment, requiring an employee to take that in order to have a lower contribution level, again as part of a wellness program, or creating incentives for them to do that. Now that's a test that takes, depending upon the vendor, between 5 and 15 minutes, that asks me all different questions about my health, about maybe my family history, which you have to be careful specifically on that question, those sets of questions based upon the 2009 GINA rules. But it'll also ask me about my cholesterol and my lifestyle and my habits and things of that sort. And statistically, the University of Michigan has really led the charge in this area to be able to help vendors take that data and make it into usable fashion. And the long and the short of it is that when you're doing a physical properly and you're gathering certain biometric data and combining that with a health risk assessment, you can predict with a little bit over 80% accuracy who your large claimants are going to be in the next 2 to 3 years. Now, that's very powerful information to know, because if you can begin coordinating that care before the fact rather than after the fact, then what you're going to see is lower healthcare costs, which lower claims means lower premiums and lower overall cost. And these efforts, oftentimes you'll see employers to be able to trim their ongoing increases pretty significantly, and in certain cases even been able to attain flat renewal increases over several years, because it makes sense. If you consider that just from, if this is 70% of claims of your overall cost and just using 80-20, the sick people contribute 56% of your costs. So if you're just 10% effective in reducing their healthcare costs, you're going to cut 5-6% out of your trend. So focus in on disease management and ways to get creative in order to create a healthier population, and your bottom line will thank you for it.